I'm Dr. Raman and today I'm going to tell you about opium and its toxicology. So let's begin with opium. So opium is highly addictive narcotic substance that is acquired in the dried latex form of opium poppy seed pod. Basically here you can see the opium poppy seed pod. It is derived from that seed pod. So next is opium is dried juice of Papaver somniferum ripe and dry poppy capsule that we can also say traces of opium. So poppy seed are also known as khaskhas in Hindi, or you can say in India it is known as khaskhas in common or layman language. So the next thing is opium poppy, that is Papaver somniferum, is the name of the species from which the drugs or you can say opium are extracted. So the Latin, even we can see the Latin botanical name explain then sedation properties of the drug, that is sleep bringing poppy and white foam. So here is the process of the collection of the opium from the seed pod. So first of all, it is the matured seed pod. After that, they will just make a cut on it of 5.5 mm cut. After that, the opium is derived from the plant with the help of something sharp object. And the left behind seed pod, after extracting the opium from it, it is also even used by some people. It is, I think, known as a posta in India. So the next is the plant itself is also valuable for ornamental purpose and has been known as common garden poppy. Poppy seeds of Papaver somniferum are also used in as food items in some countries. It's also a good source of poppy seed oil, or you can say healthy edible oil that even have many uses. The opium poppy is the principal source of all natural opiates. So the next thing is opium is the latex harvested by making incision on the green capsule. As I showed you in that picture, they make the incision of 0.5 mm. So morphine is the predominant alkaloid that is found in variety of opium poppy plants that is cultivated mostly in the I think opium producing countries. So these countries are like the countries that produce poppies as medicine are Australia, Turkey and India are also the major producers of poppy for medicinal purpose. And even you can say poppy based drugs such as morphine and codeine. Even you guys have heard about tramadol, hydrocodone, oxycodone. These all are opioids, and even in today's date many people got addicted to the opioids, and even we can say prescription opioids. So in medicine, the term opiate describe any of the narcotic opioid alkaloid found as natural products in the opium poppy plant, as well as many semi-synthetic chemicals, derivatives of such alkaloids. So next, these are the drugs that are derived from opium. So first is morphine. Morphine is a, we can say, chronic painkiller. It is used in even post-operative patients also. So next is hydromorphone, hydrocodone, oxycodone, oxymorphone, desomorphine, and the next is diacetyl morphine. It is most common in you can say Punjab state of the India. Most people got addicted to that heroin. It is also known as I think chitta in Punjab. So the next thing is nicomorphine and the dipropylomorphine, benzyl morphine, ethyl morphine. Even if we talk about the fully synthetic opioids, that is fentanyl. It is, I think, used as an anesthetic. It is a systemic anesthesia. So next is pethidine, methadone. Methadone is a drug that is derived from opium, but is also used in the treatment of opioid addiction. So next is tramadol, dextropropoxine. So if we talk about the endogenous opioid peptides, then in which these are the endorphins, enkephalines, dynorphins, endomorphins. So these are the you can say nature of the drugs. If we talk about the strong, so these are the strong drugs: morphine, pethidine, fentanyl, even alfentanil, remifentanil, and sulfentanyl. And if we talk about the intermediate, then it will be buprenorphine. I think you guys have heard in most of the, we can say, used in the treatment of heroin addiction also. So if we talk about the weak opioid, it is codeine, that is also used as a cough suppressant, but right now it is banned due to the misuse of it. So these are the naturally occurring opioids you can see on the screen. Next is semi-synthetic opioids, in which there are diamorphine. As I told you, it is also commonly known as heroin. These are the synthetic opioids. These are the opioids that have pure agonist property, and these are partial agonist. There is a buprenorphine. So these are the pure antagonists, and even you also have heard that naloxone in combination with buprenorphine is used for the treatment of heroin addiction because it is pure antagonist of the opioid. If someone have eaten, or you can say consumed buprenorphine plus naloxone, after that he or she will eat opioid, or you can say the use any type of opioid drug, then the effect of that opioid will be very less. So next is pharmacology of opioids. So basically opioids bind to the specific opioid receptors in our body. We can say it is present in central nervous system and other tissues also. There are three principal classes of opioid receptor, that are mu, kappa and delta. Although up to 17th have been reported. Here you can see the 17th receptors have been reported. And it also includes the epsilon, aorta, lambda and zeta receptors. Opioids bind to specific opioid receptors in the CNS and other tissues. So next is the uses of opioids. So first is analgesia. As we all know, the drugs that are derived from opium are used as painkillers. So the most chronic painkiller is morphine. Opioids are used for pain treatment in trauma, even cancer and other type of chronic pain also. So the next is treatment of diarrhea. Opioids also could be used in diarrhea, as opioid decrease the motility and increase the tone of intestinal circular smooth muscle. So the next is anesthesia. As I told you about, fentanyl is the strong anesthetic drug that is also being abused by some users. So opioids are used as pre-anesthetic in systemic and spinal anesthesia, and even for also post-operative analgesia. So the next thing is opioids dependence. Even you can say there are opioids that are used in the treatment of opioid addiction. So these are methadone and as I told you about buprenorphine plus naloxone, that is widely used across the world for the treatment of heroin addiction. So next is treatment of acute pulmonary edema. It is also used in pulmonary edema, as IV morphine dramatically relieve dyspnea caused by pulmonary edema that is also associated with left ventricular failure, possibly via the vasodilator effect. It also shows a vasodilation property, due to which there is a help in the acute pulmonary edema. This decreases the cardiac preload and afterload, and also the anxiety of the patient during the treatment. So the last use, we can say, the relief of cough. As you guys have known, the codeine is banned now, but it was used as a cough suppressant. And right now codeine and dextromethorphan are commonly used. Even morphine can also suppress the cough. Next is dependence of opioids. Dependence of opioids is characterized by extremely unpleasant withdrawal symptoms that occur if opioid use is abruptly discontinued after tolerance has developed. The withdrawal symptoms include severe dysphoria and even sweating, nausea, rhinorrhea, depression, severe fatigue, vomiting and pain. I think the most common symptom in the opioid dependency is, you can say, restless leg syndrome. I think many people have feel that they feel their legs are restless, And there is also a drug that is pregabalin that is most commonly used nowadays by the drug abusers to combat the withdrawal symptoms of opioids. The acute withdrawal phase is often followed by a protracted phase of depression and insomnia, and even insomnia and depression can last for months also. The next is what is drug addiction. So before moving to the addiction of opioids, we will firstly discuss the drug addiction. It is also known as substance use disorder. As drug addiction, also called substance use disorder, is a disease that affects a person's brain and behavior and leads to an inability to control the use of a legal or illegal drug or medicine. Substances such as alcohol, marijuana, nicotine also are considered drugs. When you are addicted, you may continue using the drug despite the harm it causes. And drug addiction can start with you can say experimental use of the recreational drug. So nowadays the society situations are like that, people use the recreational drug to try it, and after using continuously for few days or a few times they got addicted to the drug. So next let's move. For others, particularly with opioids, drug addiction begin when they take prescribed medicines or receive them from others who have prescriptions. So next is dependence. What is dependence? It refers to a state resulting from habitual use of the drug where negative physical withdrawal symptoms result from abrupt discontinuation. So next is tolerance. What is tolerance? It describes the need for a drug user to administer larger doses of the drug to achieve the same psychoactive effect. So here I will explain you a process. So first of all, when someone try a drug for the first time, their brain chemicals, we can say serotonin and dopamine level will rise. And after you can say the drug eliminate the body, after that the dopamine level will come to the normal. Okay, after using opium or you can say drugs for continuously, you can say for more than 5 to 6 days, in case of heroin and opium, the people begin to get tolerant to it. It means that they need large and large doses to have the same high as they are feeling with the drug. So next is cross tolerance. Exposure to one drug can produce tolerance to other similar acting drugs. So next term is metabolic tolerance. It is the reduction in amount of drug which reaches the site of action. The next is functional tolerance. It is the reduction in the reactivity of sites of the drug action. So next is dependence of opioids. So opioid addiction बस कर दा है ना इन्नी कर बाकी बात च opioid addiction वाली है ना कितनी स्लाइड है 14वीं ते आ गए अपन ठीक है 13 बनानियां याद रखी वीडियो खींचे से वो करा